there, I'm Kelly. I'm going to be your nurse today.
Hi.
Today we're going to be doing a head-to-toe assessment, basically just covering all areas of your body, okay?
Okay.
So first I'm looking at your skin. I'm just making sure that it's clean, dry, and intact. There's no lacerations, deformities, any breakdown of your skin. Making sure I'm checking the heels of your feet, especially, and your bony prominences. And your skin looks clean, dry, and intact. Just looking at your back here. Okay. Next, I'm looking at your head, noticing the shape and contour, seeing if there's any visible deformities, crepitus, masses, depression, which none are noted. And now I'm just looking at your neck, noticing your trachea is midline, there's no deviation. Gonna palpate your lymph nodes here, starting with your preauricular, using the pads of my fingertips, postauricular, occipital, cervical. Go ahead and turn your head to the side. Deep cervical, and supraclavicular. And there's no swelling or lumps noted in your neck. Now I'm just looking at your face here. I'm gonna just feel if there's any crepitus on your face. Any pain here?
Nope.
Pain here?
Nope.
So no sinus pain, maxillary or frontal sinuses. Looking at your nose, I'm noticing the shape of her nose. There's no deviation one side or the other. I don't see any bleeding or drainage of her nose. I'm going to just take a peek inside. There's no masses or polyps. There's positive light reflex. And now I'm going to test her eyes. And I want you to just look straight for me, okay? I'm going to shine the light from this side here. Noticing that there's direct and consensual reflex of the eyes. So pupils are equal, round, and reactive to light. I'm going to have you follow my finger here, okay? Oh, just try to keep your head straight for me and just follow with your eyes. Okay, EOMs are intact. There's no nystagmus noted. Next, we're going to do the Snellen chart visual exam. And we're going to be testing her vision here. So I'm going to stand right about here, and I want you to read from the top to the lowest line that you can read, okay? Do you wear glasses or anything?
I do for far away.
Okay, but you don't have contacts in right now?
Nope.
Okay, good. So go ahead.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D P C T F D P L T C E O. That's
Good.
as far as I can see.
Okay, so she has 20/40 vision, which that's excellent. That is much better than average people. Okay, now I'm going to look at her mouth. I'm noticing the lips, noticing there's no cracking or excessive dryness of the lips. I'm going to use my otoscope here again. I'm going to have you open your mouth for me, looking at the soft palate, the oral mucosa, the dentation, the back of the throat, noticing she does not have tonsils, uvula is midline. Lift up your tongue for me. Okay, the buccal mucosa is moist and pink, not pale. There's no lesions in her mouth at all. Dentation is intact. All right. Okay, now we're gonna move on to your ears, and I'm just looking at your ears, noticing that they are symmetrical. Looking at the external ear here, Noticing there's no swelling or excessive redness. I'm gonna pull up and back on the pinna. The tympanic membrane is pearl white. Pearl gray and translucent. There's no excessive swelling or redness in the inner ear. And there's positive light reflex. Look at this side. Up and back. Tympanic membrane is pearl gray and translucent as well. No excessive redness, swelling. There's positive reflex there as well. Now we're going to do a whisper test here. I'm going to just plug this side of your ear and I'm going to whisper a word over here and I want you to repeat the word, okay?
Okay.
Alright. Baseball?
Baseball.
Good. 7.
7.
Okay, so her gross hearing is intact. There's no excessive whats or ha's when asking questions and we're conversating well. Now we're going to do a Weber test on you. So I'm going to strike the tuning fork. I'm going to put it here on your forehead. And I want you to tell me if you can hear this in one ear or the other or both. Okay?
Okay.
This one's going to work.
Either one.
You hear both?
Yeah.
Good. So she should hear it in both, which she does. There's no lateralization to one side or the other. I'm going to strike this again. I'm going to put it back here and then right here, and I want you to tell me if you can hear it or not, okay?
Okay. Yes.
Okay.
Yes.
Okay. So air conduction should be greater than bone conduction, which she does hear this. So her hearing is intact. And I'm sorry, we're gonna just move back to your nose. I want you to occlude one side and just breathe in for me. Okay, and then the other side? Good, her nares are clear. Alrighty. Next, we're gonna move on to your chest. So I'm noticing her breathing, it's symmetrical, it's equal. She's not using any intercostal muscle. She's not in any type of distress with her breathing. And I'm just going to take a listen here, okay?
Yep.
Okay. I just want you to take a nice deep breath for me. Good. Okay. Good. So her lung sounds are clear to auscultation anteriorly. Now I'm going to percuss on her chest and I'm going to use my non-dominant hand and use my dominant hand to strike my finger. And resonance should be heard, and it was, and that's a normal finding. Now I'm going to place my hand right here, and I just want you to say 99 for me.
Say 99.
99.
99.
Say it again.
99. 99. 99.
Okay, frematus is noted, which is a normal finding. I'm just going to do the same with your back here, okay? I'm going to take a listen here again. So, more deep breaths. And they let me know if you get short of breath at all. Okay, lung sounds are clear to auscultation posteriorly. I'm going to percuss again on the back here, avoiding the scapula. Resonance is noted here as well. I'm going to place my hand here again, say 99.
99, 99, 99, 99, 99, 99.
Okay, fremitus is noted as well, which is, like I said, a normal finding. Now we're gonna listen to your heart here, listening to S1 and S2. And I'm going to do this midclavicular line, which is the fifth intercostal space. Okay. Use the bell here. Listen to the aortic, pulmonic, Erb's point, tricuspid, and the mitral. Alright, S1 and S2 were noted. I did not hear any murmurs or extra heartbeats, which is a normal finding. I'm going to have you lie down on your back now. And right now I'm just looking for any jugular venous distension, which I don't see any on either sides of her neck, which is good. And I'm just going to have you slowly raise up for me. Okay, and you can sit back down on this side. There was no jugular venous distension noted, which is a normal finding. Now I'm just going to palpate her pulses here. So you can keep your head straight for me. Between the trachea and sternomastoid, palpating her carotid. Making sure that I do one side at a time. And carotid pulses are strong and equal. And now her radial pulses. And those are strong and equal and regular as well. I'm going to do our dorsal pedalis, which are strong and equal. And then your posterior tibial. Which are strong and equal as well. Now we're going to move on to your abdomen. I'm going to have you lie down for me again. You can put your head over here. That would be good. Okay, so I'm just going to lift up your shirt here. Okay, I'm just assessing, are there any abnormalities, any deformities, bulging, masses, anything like that, which I don't visibly see any. After inspection, I'm going to auscultate. And bowel sounds are positive in all four quadrants. Now I'm just going to percuss here, okay? So just tap in again. Alright, and dullness is noted in the abdomen. Now I'm going to palpate. Do you have any pain anywhere?
No.
Okay. Any pain? No. Pain? No. Pain over here?
No.
Okay. No pain noted with palpation. Alright, you can sit back up for me. Alrighty. Now we would inspect the breasts at this time, palpating for any lumps or swelling, and palpate the axilla. But for the purpose of this video, we are going to defer that for now. And now we're going to test the cranial nerves. Cranial nerve number 1 is olfactory, so I'm going to have you close your eyes for me, okay? And I'm going to put something in front of your nose and I want you to tell me what you smell. Okay, go ahead.
Coffee.
Alright, perfect. It is coffee. And close your eyes again. And I want you to tell me what you smell.
Lemon.
Lemon juice it is. Olfactory number 1 is intact. We would test number 2 being optic. Number 3, you can open your eyes now. Number 3, ocular motor. Number 4, trochlear. And number 6, abducens, which we checked with her visual acuity and they were all intact. Number 5 would be the trigeminal. I'm going to place my hands here on your cheeks and I want you to clench your jaw for me. Good. So her motor function of her trigeminal nerve is intact. Now I'm going to have you close your eyes for me. And I'm going to use a Q-tip. There will be a rough side and a soft side. I want you to tell me if you can feel the sharper side or the softer side, okay?
Soft. Soft. Hard.
Okay, good. Sensation is intact of the trigeminal nerve. Next would be the facial nerve, cranial nerve number 7. I want you to lift up your eyebrows for me and puff out your cheeks. Smile. Okay, and squint your eyes closed really tight. Good. Facial nerve number 7 is intact. Next would be the acoustic, which we tested with her hearing and with the Weber test, and that was intact as well. No excessive hums or whats. We're conversating well. Number 9 would be the glossopharyngeal. And then number 10 would be the vagus nerve. I want you to swallow for me. Okay, and I'm going to use my pen here. My otoscope. And open your mouth. Swallow again. Okay, alright, let's see, open. So I'm noticing the movement of her soft palate here and her hard palate. And at this time I'm going to test cranial nerve number 12 being her hypoglossal, and stick out your tongue and say ah again.
Ah.
Okay, noticing the, stick out your tongue all the way. Okay, so the tongue is midline, the uvula is midline, there's no deviation to one side or the other. So cranial nerve number 9, 10, and 12 are intact. Number 11 is the spinal accessory. I want you to shrug your shoulders. Good. And spinal accessory nerve number 11 is intact. Now we're going to be doing reflexes. So, I'm going to bend down here again. Keep your arms straight for me. Just relax. Okay. So I'm just going to straighten this here, okay? Alright, and then just relax for me. Good. The other side. Okay, and then her knees. I'm noticing she does have a positive reaction. Try to scoot a little closer on the edge for me. Sorry, it's hard with your feet not dangling. Okay. Alright, her reflexes are intact. Now I want you to close your eyes for me. I'm going to have you hold out your palm. I'm going to place an object in your hand. I want you to tell me what the object is.
Bobby pin?
Good. And keep your eyes closed. Can I see this one? And I want you to tell me what number I'm going to draw, okay?
9.
Good. All right, you can open your eyes for me. Now, I'm actually going to have you close your eyes again for me. I'm sorry. So I'm going to strike again the Q-tip, either rough side or soft side. I want you to tell me what I'm touching, if it's the sharper side or the softer side, okay? And which limb?
Sharper.
And on which side of your body?
The right side.
Okay.
Soft.
And on which side of your body?
Left side.
Okay.
Sharp. Right side. Soft. Left side.
Okay. And now I'm going to do the same with the vibration. Keep your eyes closed for me. Which side?
Right side. Left side. Right side.
Good. So sensation is intact. Now I want you to open your hands for me. And don't let me close them, okay? All right, good. Close your hands for me. And don't let me open them. Good. Make some fists for me. Don't let me push down. And don't let me pull up. Okay, you can scoot back now. Okay, put your elbows at your side like this. Don't let me push down. Oh, don't let me pull up. Good. Hold your arms out. Don't let me push down. Don't let me pull up. Good. And stick your legs out for me. Don't let me push down. Don't let me pull up. Okay. And then go ahead and lay back down for me. We're going to be doing a lot of agilities. Okay, and your feet. I want you to push down for me. Push down. Press on the gas. Pull back. Good. Strength is intact. I will have you sit back up for me. Going to be doing a lot of moving. Okay, and now I'm going to have you stand. And I just want you to turn to the side and walk towards me. A couple steps. Okay, good. And then turn around. And heel to toe, I want you to walk back. No, I'm sorry, walk back towards me. Heel to toe. So, yeah, healing. Okay. All right, and I want you to turn. See you in the video. Close your eyes. Hold out your arms for me. Okay. Okay, good. All right. And now I want you to, so you're okay. I'm going to hold my finger out. And basically I want you to touch my finger. I'm going to kind of move it around. And I want you to touch your nose, touch my finger, touch your nose, okay?
Mm-hmm.
So go ahead. And with the other hand? Okay, good. Coordination and balance are intact. I'm going to have you come this way. And I'm just looking at her spine here. I'm going to start with C7, going down. I'm visualizing if there's any abnormalities of her spine. Palpating one vertebrae at a time. Noticing that it is aligned. There's no bulging or masses. Go ahead and bend over for me. And noticing that it's aligned here. Okay, you can stand back up for me, and we're gonna have you lie back down again. Lots of moving around. Okay, and now we're testing her range of motion. So I'm gonna just, we're gonna lift up your shoulder here, and down, and back, and across. Good, and then the elbow. Okay. And up, and down, and over, and across, and down, and up, and down. And then with the knees here, we're going to bend up, and then the hips go out, and then across. Good. And this one. Up, down, and down. Okay. Hip and knee range of motion are intact. Just the ankles here. Okay, and can you just spin it for me? There we go. Okay, and I'm palpating if there's any swelling or do you have any pain?
No.
Feeling the knees here for any swelling or fluids. In her shoulders. And I'll have you stand up for me again. Okay. And I'm just palpating the hips here. Feeling for any swelling at all. Okay, and try to bend to the side for me. There we go. And the other side. Okay, and then twist your body. All right, and you can have a seat now. That concludes our physical exam for today. Do you have any questions for me?
I don't.
All right, well, I will go speak with the doctor and we will get back with you, okay?
Thank you.
You're welcome.